Systemic lupus erythematosus. Systemic should make sense. That's multiple organ systems. Erythematosus means skin redness. And lupus means wolves. So this is, wolves that have red skin or not. Lupus also means stuff associated with the skin. So this can be like red marks that appear on the skin, which is common, a common symptom with lupus. Sometimes systemic lupus erythematosus is just shortened to SLE. Most of the time, though, we just call it lupus. Okay, lupus is a type 3 hypersensitivity reaction. That means this is a antibody-antigen complex that forms, and then those little complexes get stuck in other tissues. As the immune system tries to take care of those complexes, it causes extra damage to the body. It's an autoimmune disease, and it can affect almost every tissue. Also, because it's an autoimmune disease, we don't really know what causes it, at least what starts it. We do know a few things, though. Families tend to see multiple individuals with lupus, so it appears to have at least some sort of genetic component. Unfortunately, women are 7 to 15 times more likely to develop lupus than men. So this is the estrogen again. Estrogen's a poison, unfortunately. Some individuals can develop lupus symptoms following infections of certain viruses, things like Epstein-Barr virus. So part of what we think happens, I'm just going to come down here. So what we think happens is this. We've got cells here, and these cells have nuclei. Inside those nuclei have things like DNA, proteins, little proteins, nuclear proteins there. And these cells maybe get infected with a virus. So we've got a virus in here. The immune system goes through, attacks this, causes these cells to apoptose, and that causes the destruction of the cell, which breaks apart, and then its contents kind of spill out. So stuff kind of just floats out. So we got pieces of DNA here. We've got proteins that used to be in the nucleus. These make their way into the blood, and for some reason, the immune system starts making antibodies against these. Now, this shouldn't happen. These are self-antigens, and most of the time, the body is fine with these. But for some reason, in this development, now the body is attacking our DNA and nuclear proteins, which end up forming antibody complexes with these antigens. So DNA and proteins with antibodies. These complexes, whoops, I don't know all of that. These complexes make their way through the body, get lodged in certain tissues, and then the immune system, things like neutrophils and macrophages, will target these antibody complexes, and as they do, they destroy the healthy tissue around it. This is a type 3 hypersensitivity reaction because, again, it's an antibody-antigen complex. Then tissue damage is caused by the immune cells trying to get rid of those complexes. Now, weirdly, something that can develop later is not only do we develop antibodies against things like nuclear proteins and DNA, but given enough time, the body will start to develop antibodies against our red blood cells, white blood cells, and even platelets, leading to a whole bunch of problems. So, the clinical manifestations for lupus vary depending on where the tissues are that are being attacked. Common things can exist, things like skin rash or pain or muscle pain, joint pain, even fever. But then we get very specific things like glomerulonephritis when it targets the kidneys, inflammation of the pulmonary serous membranes, the pleura, called pleuritis, inflammation of the tissue surrounding the heart, the pericardial tissues, called pericarditis, and we can even have autoantibodies towards brain, leading to neurological damage, which can result in things like seizures and even psychosis. Because these antibodies can get lodged in the bone marrow, we can also have hematopoietic problems, lack of red blood cells, which we call anemia, lack of white blood cells, which we call leukopenia, lack of thrombocytes, which we call thrombocytopenia. So depending on where the damage occurs, that leads to different clinical manifestations. Lupus diagnosis is rough. So basically they look for risk factors, which are usually that you're a female, within birthing age, so that's going to be important for the estrogen component. And you usually tend to need to meet about 4 of the criteria of symptoms. So certain rashes in the skin, different types of arthritis, inflammation of the pulmonary or kidneys, heart problems, neurological problems. If you have enough of these symptoms, that tends to suggest that you've got lupus. There are some laboratory tests that we can do to help identify if this is lupus or not. Things like looking for antibodies that form against DNA. And while this does help, this isn't the only autoimmune disease that produces antibody DNA complement antibodies against cellular components. So it's not definitive. Another thing is just looking for general inflammatory markers. But again, that's not specific to lupus, and so that's not a significant diagnosis or a sufficient diagnosis. Usually you have to have a lot of the symptoms, have to be within a certain age range, a certain sex, and have these antibody antigen conglomerations. So with lupus, similar to our like inflammatory bowel diseases, there are flare-ups, followed by bouts of remission. So the goal really is to prevent as many flare-ups as possible, or when they do flare up, to decrease the symptoms. So anti-inflammatory agents, things like glucocorticoids, immunosuppressants, stuff that's going to decrease our immune response. Both of those together. Weirdly, treatment with like anti-malarial drugs and anti-rheumatoid drugs. I guess the rheumatoid drugs aren't as weird as you might think. Arthritis is a common symptom of lupus, and so these can help to reduce the pain in the joints caused by arthritis. But anti-malarial drugs, things like hydroxychloroquine, is kind of weird, but it has been shown as early as like World War II that hydroxychloroquine helps to reduce pleuritis, pericarditis, skin rashes, and even just like serous membrane inflammation in general. You may recognize hydroxychloroquine. This was kind of touted as a treatment for COVID-19 during the pandemic. And based on kind of what it does with other types of inflammation, it might not be hard to see why most people would think, or some people would think, that it might have some treatment abilities there. Unfortunately, though, they've done quite a few tests, and there isn't a ton of strong evidence that shows that it has much effect on COVID-19. But it's definitely not just a horse dewormer in this case. It does have some effects for lupus.